Severe knee arthritis or other debilitating knee conditions can cause a lot of pain and suffering. One option, when considering surgery, is to have both knees operated on at the same time. In this video, I'd like to discuss this significant and often life-changing procedure known as bilateral knee replacement. This surgery can be a valuable option for patients suffering from conditions in both knees simultaneously. I'm Mr. Christian Kinmont, Consultant Orthopaedic and Trauma Surgeon at Shirley Oaks Hospital in Croydon, and I've been treating patients with knee conditions for over 20 years, so have a wealth of experience in this area. So what is a bilateral knee replacement? Bilateral knee replacement refers to the surgical procedure where both knee joints are replaced during a single operation. This is different from unilateral knee replacement, where only one knee joint is replaced at a time. During a bilateral knee replacement, the damaged portions of both knee joints are removed and replaced with artificial implants made from metal and plastic components. These implants mimic the natural movement of the knee joint, helping to restore function and alleviate pain. By replacing both knees at once, patients can potentially reduce their overall recovery time and the number of surgeries they need to undergo. Why is it performed? This type of surgery is typically recommended for patients who have severe osteoarthritis or rheumatoid arthritis affecting both knees equally. The condition might cause significant pain, stiffness, and limit daily activities. When conservative treatments such as medications, physical therapy, or injections no longer provide relief, and both knees are equally compromised, a bilateral knee replacement might be considered. What are the benefits of a bilateral knee replacement? There are numerous benefits to having both knees replaced at the same time. Number one, a dual operation means that you only need one stay in hospital and one rehabilitation period. This can be more convenient and less stressful than having two separate surgeries. Number two, in some cases there may be financial benefits due to fewer hospital visits and reduced time off work. Number three, since both knees are operated on simultaneously, rehabilitation can be more balanced with no need to overcompensate for a non-operated knee. And finally, number four, for those struggling with pain and limited mobility in both knees, bilateral knee replacement can significantly improve their quality of life more quickly than having surgery on each knee in turn. This enables them to return to their normal activities more quickly. What are the risks to consider before bilateral knee replacement surgery? While there are benefits, it is important to consider the risks and challenges associated with bilateral knee replacement, such as that it requires a longer anaesthetic, mobility directly following the surgery may be more difficult, and the rehabilitation process can be intense, requiring a strong commitment from the patient to physical therapy and post-operative care. Who is a good candidate for this type of surgery? Not all patients are suitable candidates for bilateral knee replacement. Ideal candidates are generally in good overall health, have no significant cardiovascular or pulmonary issues, and are eager to play an active part in their rehabilitation. We will do a comprehensive evaluation before the operation to determine the suitability for this procedure. What happens during surgery? The surgery itself typically involves the removal of damaged cartilage and bone from the surface of the knee joint, which is then replaced with a metal and plastic prosthesis. This procedure is repeated for the second knee during the same surgical session. The surgery can take a few hours, and patients generally stay in the hospital for several days post-operatively to monitor recovery and begin physiotherapy. Post-operative care and recovery. After surgery, the initial recovery period is critical. Patients will start physical therapy soon after the operation to regain movement, strength, and flexibility in their knees. In addition to physiotherapy, patients will receive comprehensive post-operative care, including guidance on pain management, nutritional advice to support healing, and personalised exercise plans to enhance recovery. The post-operative care process also will involve pain management, preventing complications, and regular follow-up visits. Full recovery can take several months, and it's essential to follow the rehabilitation plan closely to achieve the best outcome. So, in conclusion, bilateral knee replacement can be a highly effective solution for patients suffering from severe pain and disability in both knees. While it requires careful consideration of the potential risks and benefits, For many, it can significantly improve quality of life, mobility, and overall well-being. So that's my brief guide to bilateral knee replacement surgery. If you have any more questions, feel free to leave them in the comments section below. If you would like to arrange a consultation with me or another consultant in your local area, give us a call or book an appointment at circlehealthgroup.co.uk.